The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your calls on anything you'd like to talk about your health. 888-630-9625. That's 888-630-9625. Perhaps you've had a problem, you've done everything you can think of, and, it's not worked very well. Well, here's an opportunity. How do you like to be off of, medications and live your life and bring it back? And, let's talk about some things that, everybody suffers from at one point or the other, and we're going to talk about a very interesting topic, actually one that got me into the profession of chiropractic and acupuncture and applied kinesiology. If it wasn't for my wife suffering with these very specific situations that we're going to talk about today, I wouldn't be doing what I've been doing for the last 41 years. But what are we talking about? We're talking about headaches and migraines. That's right, things that kind of wipe you out, that problem that you go and you look for drugs and medications and you live on them. And as long as I take, my Advil and aspirin and Tylenol and migraine headache formula and yada, 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 you're good, right? Well, wrong. So we're going to talk about that. But I have somebody to help talk to me about that very particular situation. This Wednesday evening at the Roselle Center for Healing, July the 25th at 7 p.m. That is the topic, headaches and migraines. And who other than somebody that you all have grown to love and respect, Dr. Qinglong Zhang.
Hi, Dr. Roselle. Hi, everybody.
Welcome.
Thank you.
This is, this man is amazing. He continues to impress me every day I walk in the clinic. Here's this wonderful human being who is not only a chiropractor, but he's a doctor of Oriental medicine. He has a master's degree in Oriental medicine. He's a licensed acupuncturist. And he puts it all together to be able to serve our patients at a level that is extraordinary and exponential. Dr. Qinglong, let's talk about what's going on with this craziness, these headaches. We have so many patients that walk into our office and they think that their headaches are normal.
Right.
They're usual, and they're not.
So that's why I chose this topic, headache, because, many years practice wherever in China or in U.S. here with in our clinic, is many patients have the headache and migraines every single day. I have patient come here, I get a call, I got an email, so I think I'm ready for have a lecture with everybody. So let's see some numbers here. Actually, in now U.S., it's 99.9% of people have headache without no sign or tissue damage.
That means all of us.
It's almost us.
Everybody.
Except Ethan, right? So also a lot of people come here, I think it's normal, I just have a headache, it's gone. However, some of them is not. Sometimes it's a red flag, it's a warning sign. Remember we talked about, for a few months ago, we talked about the body signals, warning sign. Some of them is not. You don't have enough knowledge to diagnose is normal or not. You should come to us to say it's normal or not.
So here's the deal. This is, what we talk about every day in our practice, is that when you have a symptom, and we're talking about a symptom, we're talking about headaches, and these headaches can be subdivided into groups. They can be, what they call muscle contraction headache. Yep. And that's kind of your everyday headache that people think is an everyday headache. And you can have migraines, you can have cluster headaches, and you can have space-occupying headaches. Those are tumors. We all think that our headache is a space-occupying tumor, that our brain is deteriorating, but that's not the case. That amounts to like 1 or 2% of headaches. It's very, very small.
No. For example, the migraine. Migraine is very, very common. It's about three. It happens most often in the female. So migraine actually is not headache. It's not headache. It is brain dysfunction. As a lot of people say, I have migraine, it'll go away anyway. No, your brain is dysfunctional that time already. You should pay attention to that.
So you got to be very careful when you tell people their brain's not working the way. Because if I told my wife her brain's not working, she's dysfunctional, I'd be in real trouble. But here, no, seriously, we're talking about the operation, the physiology, the function of the brain not being normal.
So what I want to explain is, we have migraine. That means your brain is disordered. That means your brain becomes very, very sensitive. It's hypersensitive to everything. Sometimes why some people come here, they are triggered by the light, triggered by some odor, something in the food, and it's even though the sound. So that means these things get together and trigger that, then cause the brain dysfunction, then you have a headache.
Here's the situation. When you think about what Dr. Qinglong just said, that there are different triggering mechanisms, and he talked about sight, he talked about odors, he talked about sound, he talked about different environmental stimuli that cause the problem to come about. That by itself should tell you that there's a physiological something that's going on that's not normal. And it can be anything from your body's inability to process these smells, odors within your environment, the carpets, the off-gassing of things, cigarette smoke. It can be that the foods that you're eating that you're allergic to and you're sensitive to. It could be the body's inability to get rid of toxins out of the liver. This Wednesday evening, the 25th at 7 p.m., Dr. Qinglong Zhang is going to be presenting all the information you can possibly wonder about headaches and migraines from a multidimensional platform. Those of you who attended his last presentation know that you better register, because we had to break it up and have it in 2 nights, and only because he was willing to do that. We were packed, and there was so many of you that registered, and some never got the opportunity to hear. So you're going to have to wait till we go online, listen to the radio program at RoselleRadio.com. You can always pick it up there, but that's just the radio program. So if you want to attend this, make sure you go to RoselleCare.com. That's RoselleCare.com, RoselleCare.com. Hit the button. It's about, a third of the way down. It says headaches and migraines, and it says register now. Well, register. And then our staff will call you to confirm, because we have to have that confirmation so we can set it up to serve you properly. So, or you want to pick up the phone, you can do that too. It's 703-698-7117. Dr. Zhang, let's get into this a little deeper. Let's kind of break these pieces up. I want to talk about what the typical headache is. It's called muscle contraction headache.
Yep.
And it's a result of the nervous system being irritated by the structural system.
Yep.
What's that all about? How does that happen?
So what has happened is the headache we divide headache is primary and secondary. So some of them, because just like you said, the neck, the muscle. If the neck muscle is pretty tight, then there's some nerve come out from the spine and innervate your muscle. The thing is, I want to clear this. Brain don't have any sensitivity to pain. The pain only being detected by the membrane and the blood vessel.
So the brain doesn't feel anything?
No, the brain doesn't feel anything.
And so the only way that we feel something's going on in the brain is by its referral area to someplace else?
Yeah, it's membrane and the blood vessel. So one thing is we have 2 very big vessels called vertebral vessel. It goes to all the way from neck go to the brain.
So they go right through the bones of the neck?
Yes.
Okay, so yeah. they go through the bones of the neck, and then they come together right at the base of the brain.
Yeah, come together and then give us blood supply to your brain. So, however, if you have some misalignment or have a degenerative change that will suppress the vessel, then your brain cannot get enough blood supply. Then you cause the blood vessel problem. Remember, blood vessel problem have the pain fibers to detect the pain.
So the vessels themselves have neurological fibers that interpret pain threshold. You talked a little bit about this, and I'll mention it quickly. I was going to talk about it a little bit later on in the program. This blood vessel, this vertebral artery, it's named after the bones, the vertebrae, and it goes through the neck. But the reason, many of my patients and you and the doctors know that before I became a chiropractor, I was on my way to medical school. I was accepted to medical school. Wow. And the reason I didn't go is I had about 11 months on my hands before classes started. So my wife and I went out to Chicago, and I started school out there. And Sue had migraines from the time she was like 5 years old. And they got worse and worse over a period of years. And to the point where when we were in our early 20s, they told her that when the medication didn't work anymore, that how they were going to fix it medically is that they were going to fuse her neck. All the bones in her neck. They were going to take her into surgery, and they're going to fuse her neck because they believed that it was an irritation, to the spinal cord, and that was the only result. Well, going back in the day, years ago, I looked at her and I said, this is not happening. No. So we started her under care at a clinic outside the school, and the short end of a very long story is that in 30 days, her migraines were completely gone. She stayed under care for quite some time to correct the spinal alignment, the curvature, and so forth. But to this day, all these years later, she's never had a headache again. Wow, that's amazing. So that's why we do what we do. Yeah, right. So let's talk about, we talk about in our profession, the nerves being irritated and, nerves being pinched. Does that happen when we have a headache? Oh, yes. It happens a lot. So actually, I tell the patients, remember we talk about the migraines, not only migraine, the headache, not only headache, it's because of brain dysfunction. When I have the patient come here to see me, they didn't complain about headache. They complain of the first thing is the spine pain, some low back pain or neck pain. But then after when I check their history, the patient, they said then they have a headache. So actually, when you headache diagnosis, whatever in Western medicine or alternative care medicine, there's no rule, there's no the lab work to diagnose headache. It all depends upon your symptoms. Then we can determine which kind of headache you have. For example, I have a patient come here to see me have the headache, and then I say, okay, you go to the CT, MRI, nothing show up, and then I say, okay, they say a lot, and how about your emotion? I said, I have very stress work. So listen, stress is not only stress, it causes a lot of problem. That's a very common reason stress causes the headache, because stress can cause the muscle tension, muscle tight, then get a vessel tight, then get a headache. So the vessels, the arteries themselves will tighten up. Right. And as you said earlier, the vessels have sensory to the pain perception, right? Yep. And so when somebody's under chronic stress, it affects the circulatory pattern to the brain as well as the spinal cord and other body areas as well. Yep. So that's one of the criteria for finding out. And you said earlier you can't diagnose a headache where it's coming from by lab work. Right, that's true. Laboratory work doesn't show anything. No, doesn't show anything. They did a lot of CT, MR, doesn't show up. Everything's normal. So the patients, right. Yeah, but I still hurt. Right. And, that's what happens. They go to their physician and they say, I got a headache. And the guy says, well, it must be all in your head. Well, it is all in your head. But it can be a stress component. It can be also from injury as well. Oh, right. Yes. Injury. That's why we call the injury pattern here. So I always have very detailed history taking for the patient. So the patient, even though the patient had injury many 20 years ago, 10 years ago, this patient thought, okay, it's too long. I don't have any injury. I said, how about 10 years ago? Oh, I did have injury 10 years ago. So then I thought, there's no way to connect each other. The yes way, because your brain still remember that things, and through subconscious still remember that. Then just ring the bell, and the dog will drill. Yeah, neurologically, the body has the amazing ability to adapt to things that happen to us, and it protects you. So there's other systems that go into effect, but they go into overdrive. Muscle tension occurs. The spine is adapted. Instead of turning your head way to the right or the left, now you don't move it at all because you know when you do it, it hurts. So we begin to change our lifestyle, and we start taking medications because, well, it's your normal headache, right? We're coming up to a break. My guest in studio, Dr. Qinglong Zhang, talking about headaches and migraines, the topic of Wednesday night's program at the Roselle Center for Healing, 7 p.m. Give us a call, 888-630-9625. We'll be right back and answer your questions. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle live. Yes, indeed, I'm in studio. 888-630-9625. That's 888-630-9625. My guest today in studio, none other than Dr. Qinglong Zhang, the guy who shows us how to put it all together from the Eastern and Western point of view. Those of you who went to his program in office about a month or so ago were totally amazed with how this man delivers information. And by the way, remember, some of you got told that there was no room. Well, make sure you call, because this is a great opportunity. He's going to be talking about things that go bump in your head, headaches and migraines, and affects 99% of the population at one level or the other. And we have many different types of headaches, and you need to distinguish. But more importantly, are you sick and tired of being sick and tired and get off the medications? Well, this is an opportunity. Do it. Register this Wednesday evening. Before we get on with the program, I want to go to the phones because several of you have been waiting patiently. Joan, how can I help you? Thank you for calling and being so patient.
Well, I was just wondering what I can do about leg cramps that happen at night, just when I'm lying in bed, or sometimes it will awaken me. But am I not drinking enough water?
That's probably the first thing I would go to. So here's the simple things to look at. Generally, leg cramps are a result of the lack of transport of certain minerals into the body, or the inability of the body to get rid of toxins and waste. So particularly in the weather that we've had, other than the rain the last couple of days, it's been very hot. And if we have a tendency to go out and not drink as much as we normally should be drinking, which is half of your body weight in ounces in water every day, particularly in this type of weather. And we need to put a little sea salt in our food and our water. If we did nothing else, if you weren't taking any supplementation, sea salt is very high in mineralization, and it helps relax all kinds of tissue, and it doesn't cause the effect of regular table salt, which is sodium chloride. So first thing I would do is encourage you to drink a lot of water. If we're coffee drinkers or soda drinkers, or we drink black teas, you're dehydrating even more, so that increases the demand for water within the body. So you want to make sure that you're drinking enough water. Secondly, you want to make sure that you get enough minerals. You can do it a little bit with the sea salt. Also, if your body's not alkaline enough, and I'm going to a little trick that a lot of you out there do, but here's a kind of an interesting thing. You're going to do some acid to make your body alkaline. What do I mean by that? You need to do about a tablespoon of Bragg's Organic apple cider vinegar and a little bit of water in the morning on an empty stomach. It alkalizes your body. It shifts. This acidic acid, it shifts to alkaline once it gets into the body, and that calms things down as well. Magnesium, particularly the glycinate form, is excellent for muscles. If you can get a low level of calcium lactate mixed with enough magnesium, it should be 1-to-1 ratio, and keep it at a low level, because a lot of us don't need a lot of calcium, but 100 milligrams maybe twice a day sometimes is plenty to make that happen. But if you just do that, I think you'll find, try those things. All those things are not anything that's going to hurt you in any way, but it can get rid of the cramps pretty quickly.
1 tablespoon of
Bragg's Organic apple cider vinegar in a little bit of water on an empty stomach.
8 ounces of water?
Yeah, 8 ounces, 4 ounces, 2 ounces.
Okay.
Depends on your tolerance.
All right. Thank you.
You're welcome. Thanks for listening. 888-630-9625. You know what? We're in a short segment, and you and I are going to talk about migraines, headaches, and we're going to walk through this whole process, but I want to take one more call. John, thank you for listening, and thank you for calling in. How can I help you?
Thank you, Doctor. I'll make this quick if I could. Dr. Poe is terrific as well.
Excellent. Thank you.
I wanted to mention, I have this bulge. It's a vein sort of thing on my left leg, the outside mid-calf.
I can't hear you, John. You're breaking up.
Oh, for crying out loud. Can you hear me now?
I'll do general. You're breaking up, you're off and on, but let me kind of address that. So if you have a bulging vein, if it's in your calf, it's a varicose vein of some sort. It's on one side. If you don't have anything else on the other side, it can be that the nervous system that side is not firing. It could cause congestion, which means stasis, which means that the blood's not returning on that side the way it's supposed to. The muscle contraction on that side is weaker than the opposite side. It can be something that we call a retrograde lymphatic problem. That means that where the circulatory pattern in the body is supposed to move up and towards the heart and then recirculated, there's a muscle actually in your chest up by the left arm, and it's called the pectoralis major minor, and that is too tight. It's cramping that return area. So if we take care of that, a lot of these things disappear. Also, hemorrhoidal or varicosities are a result of liver stagnation, liver congestion. The liver is not moving the way it's supposed to, and it can be one side or the other. The liver has a little trunk called the hepatic artery that comes off the top of it, and if the liver is congested, we end up with more types of things like this, varicose veins, hemorrhoids, and so forth. John, I hope that's useful. There's a lot of things you can do. There's a lot of nutrients. Taking low levels of vitamin E is helpful. Clearing the liver, stopping any alcohol that's in your body, going to an alkaline diet. All those things can make a big difference. You can give us a call or send us a note, and we'll try to help you out even more. We're coming up to the midpoint of the program and have to take a little bit of break for our people who bring you Dr. Tom Roselle Live. Don't go away. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. I am in studio along with Dr. Qinglong Zhang because we're talking about migraines and headaches. You know, all those things that irritate all of us, and we don't know necessarily where they come from. Well, here's an opportunity, particularly this Wednesday, July the 25th at 7 p.m. And guess what? You get to listen to this master not only in Western medicine, but combining Eastern medicine as well. And we're talking about acupuncture and herbal preparations and so forth. But, you know, those of you who heard him and are patients of him, Dr. Qinglong is an amazing practitioner. He gets it. He gets it probably more intimately than most physicians I've ever had the pleasure of knowing. So this is an opportunity this Wednesday. Go to rosellecare.com. That's ROSELLECARE, rosellecare.com. In Fairfax, you'll be able to register. Just go slide down and say, register now, get it done, and we will see you this Wednesday evening. Remember, when this man does a presentation, it's standing room only, and unfortunately, even standing room is gone. So make sure you get it done and do it today. You can call the office also. It's 703-698-7117. That's 703-698-7117. Listen, if you're on a ton of medications, right, you're on everything from, you know, Advil and ibuprofens and Tylenol and Excedrin headache formulas and things like that, or you're on some very serious medications, you know, to dumb down the effects of this bump that you got in your head that keeps exploding all over the place. Understand that there's an easier way of making that happen and go away. So this is an opportunity. You know, there's problems here that unfortunately, traditional Western medicine don't understand, and they say, take these 2 aspirin and call me in the morning next year or the year after that or whenever. Dr. Zhang,
Yeah, Dr. Zhang.
Let's start and kind of take the lid off this thing.
Yeah.
And so, again, let's spend a couple minutes talking about the types of headaches.
Yep.
And then let's talk about how we look at these things from both a Western point of view and an Eastern point of view.
Okay. So, from Western medicine side, so headache is divided primary, secondary, and the others. So primary is most include the tension type, the migraine, and the secondary, it can secondary to the tumor, to infections, to the membrane, the vessels, the muscle, and also can because the misalignment of your neck or spine. So remember, not all the neck because the whole spine. I always tell my patient. So I said, when I adjust you, I didn't adjust you not only really the pain, but also correct your brain dysfunction. What happens is, so for example, the patient have their misalignment of the spine. So we all know the spinal cord around the spinal canal, and spinal canal was made up of the vertebrae. So spinal cord connect to the brain. Then if we have the misalignment compression the spinal nerve, then spinal cord get an injury. Then spinal cord get an injury. Remember, it's going to connect the brain. Then called brain dysfunction. That's why some symptoms the patient come here for the pain, the low back or neck or thoracic. However, if you ask more history, it's a very detailed history in taking. They said, okay, I also have headache too. This is secondary.
You know, it's unfortunate that people suffer with this problem for so many years when it can be very straightforwardly addressed, and you can handle things and get your life back. You can get off these medications. Many of you are taking aspirin and aspirin-like products, and you're taking things that are even heavier than that blunt the neurological end plates. So what happens with that? Well, when you're taking aspirin, you're depleting all kinds of things from your body. You're depleting coenzyme Q10, CoQ10. If you're taking lots of aspirin or lots of Tylenol, you're going to have an effect on your kidneys and your liver. It starts breaking the liver down. And, the number one cause, by the way, for hospital admission for liver failure is Tylenol.
Yep.
And so those of you who are taking Tylenol on a regular basis, you're ruining your liver and also having an effect on your kidney.
Yep.
So is there a better way? Absolutely, there's a better way. And here's an opportunity this Wednesday evening for you to find out what that is and what you can do. These presentations are at no cost to you. It's our gift to the community. And when you have that opportunity to find out, you can make your own decisions about what you're going to do, but to find out what you can do, don't pass it up. Serious underlying causes of headaches and pressure, like tumors and stroke, are extremely rare. In fact, many people worry about that these are the primary things, and they're not. If you look at the underlying pieces that Dr. Zhang has been talking about throughout the program, muscle contractions, lifestyle, things of that nature, now you can turn things around. Dr. Zhang, you have the ability to combine both Eastern and Western medicine, and you look at it very specifically. So let's talk about, the different things you look at when it comes to headaches.
Right. I always tell patients the headache is not only the headache. What does it mean? It means something happening inside that can cause headache. Also, headache can cause something else. So what that means, when I see the patient, I try to combine from different perspective, from a chiropractic perspective and from East medicine perspective to analyze the patient. For example, if you had I have a patient, remember I told the patient have a lot of stress, have a headache, and then that headache just localized on the center of the head, on top of the head. So if you have a different area of the headache from Chinese medicine, it stands for different, the organ system dysfunctional. So the top of the head, if you headache there, it's because of your liver have issue. So that patient has a lot of stress and they come here, headache, and tell the patient, say, okay, do you have any liver dysfunction? So I don't know. I just feel the liver, the right side abdomen, their area is not discomfort. I want to check my whatever the liver function, the lab work is all normal. Not all normal. This is called no pathological change. What I want to do is, even though there's no pathological change, however, liver in Chinese medicine is an emotion organ. It's an emotion organ. If the stress can cause a lot of liver dysfunctional, it's only functional. It's not that far this to go to pathological. That is what I want to do, is prevent go to pathological change.
Here's the situation that, a lot of Western people who've never been exposed to Eastern philosophy have to understand. Mm-hmm. So you talk a little bit about the liver. And if the liver is irritated, why would it give a headache? It's because the inflammation, the inability, when the liver gets toxic or it's not working the way it's supposed to, there's a higher level of inflammatory response in the body. Yep. And as you said earlier in the program, the arteries have nerve sensors.
Yep.
And it can cause these arteries to tighten up, it can cause them to expand, it can cause them to be irritated, and that by itself causes pain. But also things that affect digestion and function, as you and I know, that the acupuncture system, ends and starts all over the place. Well, next to the eyes, there's the beginning point of the acupuncture system called gallbladder.
Yep.
And so we have the balance between liver and gallbladder.
Yep.
So now we have a backup, like a dam, like a congestion, and that causes irritation, and that channel runs over the top of the head. We also have stomach at the front of the eyes, and if the stomach is irritated in some way and can't do its job, we can have pressure and irritation causing that situation as well.
Speaking of the stomach, I do have the patient have their, we talk about a different area, related to different organ. I do have the patient have the front head pain, and also around the eye, front front head and around the eye. This is the stomach channels is going there. I said, okay. So I'm going to check there. I said, okay, do you have any stuff? I'll use the different perspective to check that. I said, okay, you have a GI tract issue. I said, how do you know? I didn't tell you any. So I just tell you about headache. I said, because from Chinese medicine, that's part related to your stomach. Stomach is your GI. It's a very, very important one of the GI tract organ. He says, oh, I do. So then she said, okay, I've been in a lot of places. Nobody tell me that. They just give me painkiller or try to adjust me. Nobody care about my stomach. Then I said, okay, it's the time. So then we use the acupuncture and the chiropractic to treat the patient's stomach and GI tract, and then the patient headache is gone for 2 weeks. It's amazing. The patient is very, very happy about that.
Yeah, you can turn it around almost immediately, and just slight changes to the body physiology, opening up the channels. I think the most difficult thing for people to understand is how acupuncture, or the philosophy, if you will, between Eastern and Western medicine actually exists. And we're talking about flows and balances. As long as the body is balanced properly, as long as the energy movement, and we can align that to electrical movements in the body, we can align it to blood flow in the body, we can align it to lymphatic flow in the body. Yep. And as long as those flows are balanced and they're moving the way they're supposed to, then the body has the opportunity to function normally. It's when there is a blockage, you will, if there is a backup, if there is an imbalance in one flow to the other, now we start seeing symptoms. Yep. And in this case, we're talking about headaches that people suffer with their entire life.
Right.
And it's not okay. It doesn't have to be. And we spend billions of dollars, billions of dollars, direct costs and indirect costs, because we don't want to go to work because we got a headache.
Because sometimes they just treat a symptom. They don't know what caused that. If you just symptoms, the cause still there, how can you expect you can treat the patient well? How can you expect you want the patient get better later? So I have now patients, we talk about the different area. The patient have the back, their output, that's like a back of head pain, and related to neck. I did a lot of the history intake into the checkup in your neural examination. I said, okay, because I asked patient, how about your bladder? You urine in the bladder. As a patient, just the eyeball is very, very big. It open the eyes big. I said, what happened? So how do you know I cannot control my urine very well? Because it's very easy for me, because it's from Chinese medicine. They are 1,000 years ago told me if you have the headache in the back and the neck, rule out the other reasons. The only reason is because the urine in the bladder channel. Yes, I do have a problem controlling my urine in the bladder.
And that's because the bladder channel starts in the eye and goes up over the top of the head, and it goes all the way down the back to the feet. So you can have symptoms anywhere along the course of where that channel goes. Yeah. It's interesting. Here's the deal. This isn't mysticism. This isn't magic. This is an amazing observation of how the body actually works. And, we have all these things. The body's just not this hard substance that we call muscles and ligaments and bones and so forth. It has many different things. What makes us alive and gives us the energy is the combination of all these things. The energy flows, and you are amazing, and because you've had the exposure of both sides of how you put this together. This Wednesday evening, the 25th, Wednesday evening, 7 p.m., Dr. Qinglong Zhang is going to be presenting an opportunity, and I'm going to put it that way, an opportunity for you to really understand what happens when you have a headache. And as you said earlier in the show, 99.9% of you will have a headache or have chronic headaches at one point or the other. And we're talking about, a headache of any sort is not normal. Yeah. And the television programs, the advertising for your normal headache, take this. There ain't no such thing as a normal headache.
Yeah, I have a patient come here and say to me, okay, I have a headache. Is it normal or not? I say, okay, all the pain, all the headache is not normal. You're not supposed to have a life with pain. So the pain, the same thing, the pain is not all in pain. Remember this word. Pain is not all in pain. Something can cause the headache, or headache is not all in the headache anyway. So something can cause headache can cause something. So if you have we call it some of the red flags. If you have pain suddenly, you never have that before. Be pay more attention about that. Don't goes to me, goes to emergency room right away. Okay, so have pain. You never had that. It's very, just like a thunder. It's very, very bad. Possibly have some bleeding in your brain. You have to take care of this. It's urgent. Also, if you have the pain, if you're over 50 years old, before they have the criteria is 40 years old, but 50 years old. Now it's that okay, if you're over 40 years old, you have chronic pain. It's also red flags. It's a lot of reasons cause about that. Also, same thing. If your children lower as younger than 5 years old, if have headache, it's still a red flags too.
Well, it is a red flag to a certain point. The thing is that you have to do the history well enough. People ask me, why do I manually adjust newborn babies? And it's because in this country, particularly, the delivery process is so egregious. What happens is that the doctor is pulling on the head of the child and putting pressure on it. And often there's a vacuum suction. Sometimes there's forceps. All those things distort the bones of the skull, the cranial plates, and now we have a buildup of pressure that can cause not only spinal problems, but also headaches as time goes on over a period of many years. Blows, kids fall, they hit their heads. And again, we go back that the greatest majority of all types of headaches, even though that we have to be more careful with an older person or a younger person, are generally not pathological. They don't have anything to do with a vessel going to break or a tumor that's in the head. Now, you have to be able to rule those things out, but we're talking about a very small percentage. We're talking 2 to 3%. Some authors will say 5%, but that's about as far as it goes. We're talking about things that are most significant, and Dr. Zhang and the doctors at the Roselle Center have the capacity to rule these things in and out.
Yeah, actually, that's only 1% have that red flags. 99% headache is we can fix that. Use our way, use our technique. So also, just now, Dr. Roselle asked me to talk about different type of headache. So how can we distinguish that? So for example, first one is tension type headache. So I have a tension type headache. It's a very, very typical sign is they have bed-like headache and the both sides of the head. It's just a bed-lined band.
A belt around the head.
Yeah, right.
Hang on to that thought. We're going to get back because we're coming up to a break. And, there are distinguishing features when you have a belt-like headache, whether you wake up in the morning with it or it's later on the day that it shows up, whether your eyes feel like they're popping out of your head or, you get dizzy with them. But, again, it's the chronicity in the presentation. And sometimes medication that you're taking for other things are going to cause your headaches. Now, think about that for a second as we're coming up to the break. You're listening to Dr. Tom Roselle live, and Dr. Qinglong Zhang, my guest in studio, your host this Wednesday evening, 7 p.m. at the Roselle Center for Healing. Don't go away. We'll be right back.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You've been listening to Dr. Tom Roselle live, as you do every Sunday at high noon on the Eastern Seaboard. And those of you around the country and are listening, and we thank you very much. Do the math. You know what time it is where you are. And we also like to extend our love, our appreciation, our thanks for our armed forces and those of you who do listen to us. And I don't know sometimes how you get a hold of us and how you're listening, but you are, and we try to answer your emails and get back to you as best that we possibly can. Thank you so very much. 888-630-9625. That's how you reach us here at the station when we're doing the program, and how you reach us when we're not here. You go to rosellecare.com. That's ROSELLECARE.com, or simply call 703-698-7117. And those are the numbers you're going to use to register for Dr. Qinglong Zhang's presentation this Wednesday, the 25th, 7 p.m. at the Fairfax office of the Roselle Center for Healing. And he's going to be talking about those things that beat your head up and you feel lousy and you're taking medications for them and have been for years. And as long as you take your whatever you name the drug, that you can limp along and do okay. Well, here's an opportunity to find out not only what's causing them, but what you can do about them and get your life back. I'm going to kind of just throw something in. I'm going to spend a whole program on this shortly, probably within the next few weeks. Did you know that there is a type of medication and also something that they put in your water that is a major cause of all kinds of disease processes within the body, but also headaches, and that's why I brought it up. What am I talking about? I'm talking about fluorides. So when you go to the dentist and you have a fluoride treatment for your teeth, or you're drinking water that has fluoride in it, you have the potential of having all kinds of disease issues. Back prior to 1945, when they started, when communal water fluoridation took place, and that's how long it's been, fluoride then was known as a neurotoxin and would cause degenerative disease for your body across the board in a lot of different areas, particularly your heart, your lungs, your liver, your kidneys, and so forth. So we're going to get into that in another program coming up, but right now we're going to talk about the general things of headache. Dr. Zhang,
Yep.
Let's talk about the program Wednesday evening. We have a short time segment here. Tell us what you're going to be covering this Wednesday.
So this Wednesday, I will cover I will try to combine the chiropractic perspective and the East medicine perspective to give you guys how to diagnose headache, how to treat headache, how can we use some trick. You can go home if you have headache. You can use that to take home message, take home message to treat the headache. This is what I want to tell you guys. That's Wednesday.
And those of you who have been to his programs before know that you're going to walk away with so much information. I mean, he's going to give you and give you and give you, because this is the nature of this man. He just doesn't know when to stop. And he comes from the heart. And, so I'm going to ask you a question I asked you, in a different program, in a different way. Are the 90% of all headaches, are they completely and totally resolvable, fixable?
The answer is absolutely yes, for sure.
So what stops somebody from not getting well in about 10 seconds?
What?
Why won't they get well? If they have a headache and they can get well, why wouldn't they get well?
Because they don't come here to our office.
Exactly.
Yeah, that's true.
Good answer. So this Wednesday evening, you have the opportunity of hearing a master, and he's going to look at it from a couple different perspectives. I mean, seriously, join us. It's a lot of fun. He's very engaging, very light. You'll enjoy this presentation, but make sure that you call, because we have to confirm, as we said, when this presentation, anything that he does, takes place, it's over the top, and we don't have enough room. So 703-698-7117 or rosellecare.com. We're coming up to that point of the program where I have to say adieu and see you next week. Just remember, we love you all. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.